Let's talk about two common causes for iron deficiency and the more severe iron deficiency anemia. Now, if you've been diagnosed with either of those conditions, you probably went through an evaluation to look for sources of blood loss, like gastrointestinal bleeding or excessive menstrual cycles. So sometimes there is a cause identified, a bleeding cause identified, but many times a cause is not identified, and your doctor says, we don't know why you have iron deficiency anemia. He or she prescribes iron supplements or prescription iron or even intravenous iron. Sometimes the anemia gets so severe that people have to get blood cell transfusions and go through diagnostic procedures like bone marrow biopsy to see if your bone marrow is producing red blood cells. But you're left with anemia that's unexplained. And sometimes anemia that's uncorrectable, and you live with hemoglobin levels of 7 or 8 or 9 when normal is about 14. And you're chronically tired and breathless and cold and stuck on all those efforts to replace the iron. So consider these two causes of iron deficiency and iron deficiency anemia. 1, wheat and grain consumption. Well, why would wheat and grain consumption cause iron deficiency? Well, there's something in wheat and related grains called phytates, and phytates are very effective at binding the iron in your gastrointestinal tract and making it unavailable for absorption. You just pass it out into the toilet. So even if you had an iron-rich meal, let's say some beef or liver, you don't absorb the iron and you just flush it down into the toilet. And that means your anemia cannot respond because you're not absorbing the iron. And even if you're taking iron supplements or iron medication, you do not absorb the iron effectively because of the phytates. And modern strains of wheat have been selected to have higher phytate content. That's because phytates are also pest-resistant compounds. They fight off fungi and molds and rusts and insects. And so modern strains of wheat, and thereby wheat products, have greater phytate content. It means that the capacity to impair iron absorption has been increased, has been amplified in modern wheat. And so it's a flagrant cause for anemia. When you remove grain phytates, that is, stop all wheat and grains, there can be a dramatic return of a normal hemoglobin, typically within 2 or 3 weeks. It's very rapid. And you can get rid of all those other silly efforts that do not work in the presence of phytates. So that's a cause that's easy to remedy, right? If wheat and grain phytates cause it, don't eat wheat and grain phytates. Another common cause is autoimmune gastritis. This is a bit more complex. This is a situation in which your body has been tricked somehow into attacking the stomach lining, but specifically what are called the parietal cells of the stomach lining. The parietal cells produce stomach acid and also produce a compound that allows you to absorb vitamin B12. So autoimmune gastritis is typically accompanied by vitamin B12 deficiency as well as iron deficiency and iron deficiency anemia. And the reason why iron deficiency anemia develops is because you need stomach acid to facilitate absorption of iron. Now, this is a little trickier to diagnose. It can be diagnosed with an endoscope, an endoscopy, but you can also diagnose it with some blood tests, a parietal cell antibody test, and a serum gastrin test. So your doctor can indeed identify autoimmune gastritis. The bad part of this is, you get to a certain point, your stomach won't recover, and it can't produce stomach acid, or it produces insufficient quantities of stomach acid. Those are called hypochlorhydria, low stomach acid, or achlorhydria, no stomach acid. Unfortunately, you stop all the grains that often are the initiating cause of autoimmune gastritis in many people, but the parietal cells don't come back. And so you're stuck with strategies like taking betaine hydrochloride for acid. Some people like to use vinegars like apple cider vinegar with their meals, and that acidifies the food and helps to absorb iron. You'll also have to address the B12 deficiency. The key here is don't allow yourself to develop autoimmune gastritis. That's also a risk factor, by the way, for stomach cancer, as well as SIBO, small intestinal bacterial overgrowth, because a lack of stomach acid allows entry and proliferation of unhealthy bacterial species that like to ascend. And now you have a whole set of other problems. Facilitation of autoimmune diseases, fibromyalgia, irritable bowel syndrome symptoms, risk for diverticular disease and colon cancer. So because the therapies for autoimmune gastritis are very inadequate, very incomplete, unsatisfactory, the key here is don't allow it to happen. How do you do that? don't eat wheat and grains that initiate the process, and address your vitamin D, and address bowel flora efforts, as we do in all my Wheat Belly Total Health, Wheat Belly 10-Day Grain Detox, and Undoctored books. Now, I'll be talking more about these kinds of issues. These are admittedly more complicated issues, and so if you really want a deep dive, I invite you to join our conversations in our Undoctored Inner Circle, such as our two-way video meetups, virtual meetups, because these are a bit more complicated, and it helps to discuss these issues with other people, with me, our health coaches, etc. So join the conversations if you want to pursue these questions. But bottom line here, recognize that there are two fairly common causes of iron deficiency anemia that you can address, or at least begin to address, that most doctors won't even tell you about.